right. So I'm going to be talking about internet addiction and specifically the case of Mark today. So I'll talk about some different approaches to treatment. I'll go over his case study, talk about some diagnoses. We'll talk about ethical and cultural considerations, and we'll just end with some treatment recommendations. So the case study of Mark. So Mark is an 11th grader. He was adopted. Both of his parents work, which means he has a couple of hours after school of downtime, which will become important later as we talk more about his case. Mark has been increasing the amount of time he spends engaged online, particularly with social media sites and online gaming. He's also recently had his phone taken away by his parents due to receiving in-school suspension, because he was on the app Snapchat in his math class. Mark's increased internet use has led to him failing classes due to missed homework assignments, avoiding interactions at home with family and friends, isolation and refusal to come out of his room even during meal times, lethargy, and decreased socialization with his cousin, who he used to hang out with every day. Mark prefers online social interactions over real-life social interactions, as he feels he meets more understanding people from all over. He's not the only one that feels this way. After looking through a lot of research about this, a lot of young people and adolescents actually prefer online social engagement over real-life engagement. So the first approach that I looked at was cognitive behavioral therapy internet addiction, which is an approach for working with people addicted to the internet developed by Jung, and it combines elements of cognitive behavioral therapy and harm reduction therapy. So CBT is based on the theory that one's thoughts determine one's feelings. More specifically, the cognitive model describes how individual perceptions or thoughts about situations influence their emotional, behavioral, and physiological reactions. So CBT also posits that an individual's perceptions can become distorted or dysfunctional when they are in distress, and that they can learn to challenge their thoughts and change them to be more realistic, and therefore learn to become more functional. The other piece to this therapy is harm reduction. So harm reduction can be described as a strategy directed towards an individual or a group which aims to reduce the harms associated with certain behaviors. So those negative outcomes, those that are and consequences that are associated with the overuse of the internet. So, in Mark's case, it's affecting his school, his social interactions and relationships, and we'll see other areas of his life, like his physical health and sleep and things like this, that it's also impacting. So harm reduction comes from that perspective that it's decreasing the amount of time spent on the internet. It's balancing different things. It's not abstaining from the internet, because that's not a realistic view given the world we live in, the world that Mark lives in. It's not really a realistic view to completely cut out the internet, as we use it for so many things. I mean, I'm using it right now as I'm giving this presentation. So some of the counselor and client roles with CBTIA. It goes through about 3 different kind of stages. So the early stages of therapy should be behavioral, focusing on specific behaviors and situations where the impulse control disorder of internet addiction causes greatest difficulty. So an example of one of the articles I was looking at suggested an internet log is used to determine time spent online. So it's actually a log that the client would fill out. And then as therapy progresses, the focus shifts to clients' cognitive assumptions and distortions and how they affect the client's behavior. So this is really challenging those dysfunctional thoughts they may have regarding using the internet. So for example, with Mark's case, you know, it talked about how he waited till he got home from school so he could automatically connect with his friends online, and how leading up to that point he had increasing levels of anxiety. So, maybe one of his thoughts is like, if I don't connect with my friends right after school, like I might miss something, or I might not have that connection. Whatever it is, you're able to challenge some of their thoughts regarding the internet. And a lot of thoughts the research shows is leading to the internet equating to a better life in some way. Okay, so after the CBT piece, harm reduction is kind of the final phase that's utilized to decrease the amount of time spent online to reduce those negative consequences. So failing his classes, receiving in-school suspension, having his phone privilege revoked, his eating and sleeping habits have changed, and also decreased socialization with his peers and real-life interactions. Let's see. So some of the counseling techniques include assessment of the type of distortion, problem-solving skills, and coping strategies training, modeling in therapy, support groups, and thought monitoring. It obviously requires active participation and collaboration between both counselor and client. So some of the benefits and limitations of CBT-IA. Especially with the case of Mark, reducing the amount of time he spends online can reduce some of those negative consequences he's experiencing, like failing his classes. If he dedicated specific time to that and to the internet instead of all his time to the internet, then he might be able to get his homework assignments done, for example. Also, CBT, it suggested, and especially the article I read, this Young article, that it requires about 3 months of treatment or approximately 12 weekly sessions, and that was what they did, was 12 weekly sessions. It can be utilized with adolescents and adults who meet criteria for internet addiction. However, in this specific article, they worked solely with adults. And Young actually also developed the internet addiction test. So that is an assessment to determine if you meet criteria for an internet addiction. Also, the internet addiction test is a worldwide accepted and validated instrument that examines symptoms of internet addiction, such as like the user's preoccupation with internet use, ability to control online use, the extent of hiding or lying about online use, and continued use despite negative consequences of the behavior. So this assessment, it's a 20-item test, and it's also been validated in several other countries. So this is a validated measure for internet addiction. Let's see. So in this specific article with the CBT-IA, they used the Internet Addiction Diagnostic Questionnaire was the other assessment they used to measure the treatment outcomes. So the results showed that a majority of participants were able to manage their symptoms of internet addiction by the 12th session, by the final session of this therapy treatment program. And they were able to maintain symptom management and recovery. So they did 1 month, 3 month, and 6 month post follow-up, and 70% of them were able to maintain and manage their symptoms of internet addiction. So one of the studies found by Young were factors associated with relapse actually included family or marital disturbance or a lack of sponsorship with their internet addiction. So a lack, I guess, of that support system, which is really interesting as we move into the next therapy. So a lot of the research talked about some of those risks associated with increased internet addiction, particularly with adolescents. Had a lot to do with family and factors. So the second approach that I looked at was family therapy approach to internet addiction. So the main study I looked at talked about family factors that contributed to internet addiction. Reported higher levels of parent-adolescent conflict and lower family functioning were associated with internet addiction in adolescents. Another study looked at the effects of parental monitoring, leisure boredom, and leisure activity with internet-addicted adolescents. And the results showed that leisure boredom and involvement in the internet as a social leisure activity increase the probability of internet addiction, whereas family and outdoor activities, along with participative and supportive parental monitoring, decrease the tendencies, and they were a major inhibitor of internet addiction. Another study Young conducted also emphasized that parental efforts such as limit setting with respect to playing time and switching from the computer use from game time to doing homework are important elements in the treatment of internet addiction. Once again, that also relates back to that harm reduction component where you're, assigning appropriate time to playtime and homework time and not completely cutting it out, because that, again, it's not really realistic, especially with this case or in the world we live in. Some of the counselor and client roles. So, I'm sorry, I went ahead. So one of the treatments that I looked at with this study, it comprised of 7 treatment days, I believe, with families. So the first day of family therapy, they completed assessments of the family functioning cohesion, which I'll talk about more in a second. And then there was a child psychiatrist who worked with the family members to share interaction focused on reduction of problem behaviors and increasing family cohesion. And then families were asked to work on their new interaction activities for more than an hour per day, more than 4 days per week. So whether that was doing activities together like swimming or playing games or like board games or other activities, other sports, those are some things that they came up with to create more family cohesion. So during the other treatment days, they were asked to describe their family activities, and then the adolescents were reinforced by given like small gifts or stickers. They also met with the child psychiatrist to continue focusing on steps to continue improving their family dynamics. And the results indicated a significant decrease in the IAT, internet addiction treatment scores, an increase in family adaptability, partnership growth, affection, and resolve scores. So that was the assessment they did to measure family function and cohesion. Let's see, I think I have more information on that in just a minute. Yes, I'm going to skip ahead really quick because the family adaptability, partnership growth, affection, and resolve scores, that was the assessment to, actually, I'm going to go back. I'm getting ahead of myself. counselor and client roles with the family therapy that I looked at. So in the first study, the psychiatrist's role was to help families create those activities and exercises so that and so it's a collaborative process with the client, the counselor, the families. So the counselor facilitates active participation among all family members and assigns homework throughout the week. So clients are obviously required to engage with family members more frequently and with parents and parental figures. And parental figures are also responsible for their active participation and involvement. And so we're going to talk about some of the benefits and limitations of family therapy. So family-based interventions are the most studied treatment modality for adolescent substance dependence and addiction, with a large body of research to support its efficacy. So not just internet addiction, but other substance dependencies and other addictions. Family-based interventions are the most studied. So in the study that I previously talked about, there were 7 sessions of the family therapy, which included those assessments in kind of the beginning and then at the end. So it's a relatively brief therapy process. One limitation to this study in particular is that differences in family structure weren't considered. So single parent household, number of siblings, and different child rearing styles weren't really looked into, which might affect the outcome or how families relate to each other. It requires active participation and involvement of several family members. It could be both parental figures. It could be also siblings. It could just be 2 people. But it might be more difficult to achieve just depending on like work schedules and things like that, because it takes more involvement. And if you're not used to having that involvement, like in the case of Mark, like he has a couple hours after school of complete downtime. So since both of his parents work, there might be more limited times when they're able to engage in those family activities. Parents' emotional support and care are protective factors to low levels of adolescent internet addiction. And then conversely, lack of familial affective involvement, high family conflict, low parental monitoring, as well as parental abuse, like emotional neglect, are risk factors to internet addiction, essentially. So, in looking at internet addiction, I also found it interesting that there was specific like individual characteristics. So impulsivity, shyness, introversion, social withdrawal, aggression, poor self-control, narcissist personality, along with like family components, social economic status, attachment, parenting style, parent-adolescent conflict, parental monitoring, family function, family cohesion, and adaptability. These were all considered to be contributing factors to internet addiction. Also, when considering treatment for internet addiction, you have to realize that so many people have access to the internet 24/7. It's such an integral part of our daily life that it might be more difficult to recognize as a concern in general. There are still some disagreements among the definition of internet addiction, if it really is an addiction. So you just have to consider how functioning and realize, it might be a little more difficult to address as a concern. A lot of the research showed that males tended to be more likely addicted to the internet than females. And interestingly, Mark is a male, given that he identifies as a male. The internet also provides an environment that can be abused by anyone with access to it, that is, because not everyone in this world has access, but a majority of people do. So it's particularly abused by adolescents and younger people, given their lower cognitive and self-control ability, and also due to like more exposure to the internet, because it's been something with them through their entire lives. So Mark also is an adolescent. He's in the 11th grades in high school. So it's also important to look at other cultural influences, like your view of family, which could impact family therapy and how you work with family. One example was collectivistic cultures versus individualistic cultures, because a lot of these studies of internet addiction and treatment and family therapy are more Eastern, like in China there, and things like that. There's a lot of these studies going on. So it would be important to look at that when doing family therapy, as far as how it's important to be within your family group. And then also Mark is adopted, so that's another cultural piece. So working on building those family relationships could be an important aspect of his development, and interpersonal relationships is a thought that I had, because since he's adopted, like I don't know like all the information about it, but that was something that he brought up as a concern, that some of his friends didn't understand what it's like to be adopted. And so that makes me think about his, what are his family issues or concerns, and maybe he does need to have more involvement with his family, with his parents. So moving along to the diagnosis, internet addiction is actually not yet recognized as a mental disorder in the Diagnostic and Statistical Manual for Mental Disorders, DSM-5. However, internet gaming disorder is listed in the DSM-5 as a condition for further study. And so I kind of compared Mark's internet use, which includes online gaming and social media sites, all in one, and related it to internet gaming disorder, because there are specific criteria that have been established to look at internet gaming disorder. So some of the criteria that Mark met was a preoccupation with internet games. So it's mentioned, he couldn't wait until he got home from school in order to get online and play internet games with his friends. Also, withdrawal symptoms when the internet's taken away, like irritability, anxiety. Anxiety was definitely mentioned in the case study. Also, tolerance was another criteria, which suggests the need to spend increasing amounts of time engaged in internet games. And Mark has shown an increase in time spent involved on the internet. A loss of interest in previous hobbies and entertainment as a result of internet games or internet use in Mark's case. So, he's not playing basketball anymore that he used to do. Some of his other things that he actually used to do, he's not doing anymore. He's not even eating properly. We'll get to that in a second. Continued excessive use of internet games despite knowledge of psychosocial problems. So, like, he's avoiding all social interaction. He's not even coming out of his room for meal times, and not engaging with his parents and like his cousin, which he used to do. Losing a significant relationship because of participation in internet games. Now, I don't know for sure that he lost a significant relationship with his cousin, but I do know that he used to hang out with his cousin like almost every single day, and now he's completely stopped doing that. So he definitely meets criteria for internet gaming disorder, or all of his internet use falls under that. Um, Also, to consider with this diagnosis of internet gaming disorder, um, is that it leads to clinically significant impairment or distress indicated by or more of the following symptoms, which I just went over, or I mean criteria, not symptoms, criteria, following a 12-month period. Um, so again, just to recap, some of his symptoms include feeling anxious when he's not using the internet, avoidance of social interactions with family and friends, isolation, refusing to leave his room, feeling tired and lethargic, decreased socialization, and real life interactions with others. Um, he spends more and more time online. It's affecting, both his social interpersonal relationships and his school performance, both behaviorally and academically. Yes, so it's not, so I don't have like specific code to give him because it's not considered a diagnosis, but it is in obviously all the research that they're gathering now even is going to add to internet gaming disorder, or considering internet addiction disorder as a serious disorder, so that people can hopefully get treatment for it. So some of the rule-outs that I looked at were ADHD was one. It was a big one because in the research it showed that one of the biggest co-occurring disorders with internet addiction was ADHD. So they found a lot of these behaviors. And if you think about some of the diagnostic criteria of ADHD and some of those behaviors, it really with impulsivity and just some of these other symptoms, criteria of ADHD, it really fits with being engaged online on the internet. And so I think that I will want to make sure I rule out ADHD as a possibility for Mark. Also, because it mentioned some anxiety and depression symptoms in the case, I want to look into that to make sure I'm accounting for those specific symptoms, which I guess could be a negative consequence of his increased internet use, but I just want to make sure I'm accounting for those. I looked at the other conditions for study. One of them was the parent-child relational problem, just highlighting that relationship and how the research shows that without family cohesion and parental monitoring and things like this, without that involvement from the parent side of things, how that can definitely be a risk factor or lead to more internet addiction. So I would definitely want to look at that. And then I also wanted to consider his sleep and nutrition and his physical health as well, because his mom is noticing that he's really tired. And I mean, if he's not even coming out of his room for mealtime, is he, getting adequate nutrition and sleep? So just quickly, we're going to finish up here with the levels of care and treatment recommendations. So when we're looking at the severity scales, which are mentioned in the DSM-5 of other substance use and addiction disorders, it's based upon how many criterion are these individuals meeting listed under these specific addictive disorders. So with Mark, he met at least 5, maybe 5 to 6 criteria, especially given further information from him and from his family. It would rate the level of severity of his internet addiction from about moderate to severe, so on the higher end of things. So it's suggesting that it's severely impacting his current social functioning, emotional, physical, and school functioning. We're seeing, some of these consequences, negative consequences to that increased use of internet use, both like in his environment and then personally, even in himself. And okay, so the levels of care, the American Society of Addiction Medicine developed the criteria for the continuum of treatment care, and they proposed 4 levels of care. So specifically with Mark, I recommended the outpatient treatment, as most of the treatment options out there in the research are more outpatient based, where it's either individual or family based therapy, but it's usually in an outpatient setting, and it's usually, like with the CBT, it's like 12 weeks long, 3 months. It could be 7 sessions long. It could be, so it's a relatively brief therapy. And I thought that would be probably best suited for Mark, given his situation. He's still in school, so we don't want to like pull him out of school completely. I didn't feel like, and then also you have to consider like, I guess, costs of like therapy. I don't know. There's lots of things you have to consider, I guess. So there was a study out there I looked at that talked about like inpatient, so a higher level of care. It was inpatient services, where you're completely taken out of your environment and you stay in a residential place for people with internet addiction, and they actually go through the process of like the first process of completely like cutting it out and going through those withdrawal symptoms and things like that. It's kind of interesting, but given also in that study you had to be an adult, I felt like the best for Mark would be outpatient treatment. And so in the research that I looked at, I would recommend like family-based therapy is specifically important to Mark's case, given what the research is saying, or like a multi-level counseling model, which was in another study that I looked at, which incorporated components of family therapy, individual therapy, and like peer groups. So the treatment model itself incorporated like several elements, including like the different multi-level counseling model I just talked about, and the emphasis on controlled and health use of the internet, understanding the change process in adolescents with internet addiction behavior, utilization of motivational interviewing model, and adoption of a family perspective. And so this multi-level intervention model was based upon the integration of research findings based on substance abuse and addiction. So I found that was interesting. It's kind of a multi-approach to therapy. So yeah, these are some thoughts regarding the case of Mark. I hope you enjoyed the presentation, and if you have any further questions, feel free to ask. Thank you.